Hello, everybody. This is Dr. Michael Hirsch from the Division of Public Health in the City of Worcester and the Chief Information Officer for the pandemic. Coming back to you with another little chat about where we are in the pandemic. And this is obviously a very exciting time, a very concerning time, but it is a new year, and we have a new attitude with this new year that finally we are on the offense against this virus. We're not simply playing defense. We are finally blessed with two versions of a very, very effective, 95% effective vaccination, one called Moderna and one called Pfizer. And these are being given as we speak to our hospital front-facing workers that are in all fields of medicine, right now at St. Vincent's and at University of Massachusetts Medical Center. And we here in the city next week will be administering the dosing to our wonderful first responders, the firefighters, our police officers, and the ambulance services that are from the private sector, because UMass has very graciously agreed to vaccinate the Worcester EMS service themselves. So this is phase one of a very, very intricate system of vaccination. And that's what I really wanted to talk about a little bit today, is how this is all going to roll out to you, what role you will play in the success or failure of this program, and kind of address some of the frequently asked questions that we've had on some of the chats that we've done for city workers and for others, where I think a lot of the concerns have come regarding the vaccine. So let me start by saying where we are in the pandemic. We're 10 months into this now, and we are right now in January of 2021 in the teeth of the second surge. The second surge started shortly before Thanksgiving. It really, really got buzzed up after Thanksgiving with all the travel that was done, despite all the warnings we had about not doing big family gatherings and not traveling. I think people let their guard down a little bit, and they went ahead and did all those things. And as a result, we started seeing weeks here in Worcester where we were identifying over 200, even over 300 new cases a day. It's been a very, very hard December. With that, when you get those kind of numbers, you get more hospitalizations, you get more people in the ICU, and unfortunately, you get more deaths. And we're still in the teeth of that because, similar to Thanksgiving, in Christmas and New Year's celebrations, a lot of folks kind of didn't follow the 3 W's, the wear your mask, watch your distance, and wash your hands. And they didn't keep their gatherings just to their immediate family. And by doing so, we're starting to see really high numbers coming out of Christmas, and now we haven't even seen the results of the travel for New Year's. So I think that January is going to be the most vicious month we've had. I'm hoping that we will see the crest of this wave kind of recede towards the end of February, but we're in for a lot of cases, and we're in for a lot of trouble because the virus seems to have mutated into a more transmissible form. It's very, very easy to contract this virus now, and we've had many, many patients come into the hospital. That's why I'm dressed like this. I've been in the hospital since last Thursday, essentially, covering for pediatric surgery. But we've had many, many patients tell us, I've done everything right. I've followed the 3 W's. I've stayed in my bubble. I still got it. We don't know how they're getting it necessarily, but that virus right now is very, very, very transmissible, and you can get it quite easily. So we're really advising seniors especially, if you don't have to go out of the home, stay at home. Get your home delivery, get your takeout, get your shopping done virtually. Do not get out and about in Worcester right now or anywhere, because it's very, very prevalent all through the community. We have testing sites, as you know, at the Mercantile Center downtown, and still there's testing going on at Family Health Center and also at the Edward M. Kennedy Center. And the positivity rates weekly for everyone getting tested keep going up. We're almost at a point where 1 out of 3 people that come in to get tested test positive for coronavirus. That's an amazing statistic, and it seems to be still on the rise. So that's where we're at. But that's the negative, right? That's my Debbie Downer part of this speech. The good part is that we have the vaccine approved, and so far in Worcester we've given out almost 7,000 doses of this to medical staff. That's our phase 1. Phase 1 is giving it to medical staff. It's also giving it to inhabitants of long-term care facilities. And Walgreens and CVS have contracted to help do that. And they've been very efficient about it, not just giving it to the inhabitants there, but also the essential workers who work there. And that's our plan, hopefully, as we move from phase 1 to phase 2. We're going to be doing the first responders, like I mentioned, the fire and police. Then we're going to transition over to a number of priorities for phase 2. Anyone over the age of 75, and that might be you as a senior center person. If you're over 65 and you have 1 or 2 what we call comorbidities, let's say you have diabetes, let's say you're a cancer survivor, let's say you have lung or heart disease. If you have any one of combination of 2 of those, 65 and over, you would qualify for early injection in phase 2. We're also going to be doing home health aides, visiting nurses, essential workers in the big box grocery stores, and who help us all through the city with trash collection at the Department of Public Works, etc. We also are going to be doing in phase 2 the community of color, because the Black community, the Latinx community have been disproportionately affected by the coronavirus, and we want to give them the opportunity to even the playing field, if we can, by getting them early vaccination. We also are going to be doing the teachers from K through 12, because we want them to be protected so that we can get kids back to school as soon as possible. So if that's going to be essentially the essence of phase 2. Phase 3 is going to be general distribution for everyone. And those pharmacies that I mentioned before, CVS and Walgreens, have bought billions of doses of this, and they're going to be offering this. But also, the state has informed us that Worcester is going to be a site for a super vaccination center. We don't know where it's going to be located yet, but we do know that it's going to be in operation, we think, for about 6 months at least, where we can hopefully get those phase 2 people done in that fashion. And we will be getting help from the state in doing that. As far as phase 1 goes, we're using the wonderful Worcester Senior Center that you guys are so used to attending as a vaccination center. We've done this before when we used to do flu vaccine campaigns in the days that you might remember when Commissioner Leonard Morse was the director of the Department of Public Health. We had a community immunity program that we ran out of the senior center, and we did vaccinations there. We also used it for the H1N1 or swine flu outbreak in 2009. This is going to be a much more aggressive kind of vaccination program. We're going to try to crank out about 300 vaccinations a day there. We think that in this phase 1 area, we are going to need to give out about 3,000 vaccinations. So that will be, something like a 2-week period of nonstop vaccinations. And then hopefully we can move on to phase 2 pretty rapidly. Now, you may have been hearing that both of these Moderna and Pfizer versions of the vaccine need to have a booster shot. The Pfizer version needs one in 3 weeks, and the Moderna version needs one in 4 weeks. So there's a lot of moving parts. If you end up getting a vaccine, you're going to be given a card and you're going to be given a return appointment right away, so we know that you're going to be coming back to getting your booster. Without the booster, you will get some immunity, but you won't get nearly the 95% mark that has been tested for these vaccines unless you get the second shot. That 95% immunity is only achievable about 6 weeks after the second shot. So it's going to take a little time before we start really seeing some community immunity happen. And that's why we're anticipating the first 6 months of 2021 are not going to be all that different than what we did in 2020. We still want the 3 Ws. Why? Because if you get vaccinated, you don't get immunity right away, like I told you. And also, we don't know if the vaccine will stop you from being a silent spreader. These are the people that don't have any symptoms themselves, because maybe the vaccine is fighting the virus off just fine, but somehow you're still carrying the virus. We don't know that yet. There's a lot of tests that are going to be done once we have this big group of people that have been vaccinated to see if any of them are carrying the virus. So there's a lot of unanswered questions, almost as many unanswered questions as there are answered questions. But at least now we have a weapon to fight this virus, and other than the 3 Ws. So I think most of our listeners today hearing me will probably qualify for early phase 2 vaccination. And we think that's going to start as early as the last week in January, first week in February. There's going to be a website where you can schedule an appointment. We're going to have you come in. You'll get your vaccination. You'll be asked to go through a screening questionnaire before you get the vaccine. The only reasons that we wouldn't want you to get the vaccine would be if you have severe allergic reactions in your past. If you're the kind of person that's carrying around an EpiPen, meaning epinephrine for like a bee sting that you once had where you blew up like a balloon, or some food allergy that really has knocked you for a loop. If you're that kind of person, you probably should not get the vaccination. If you also have had the virus, if you were unfortunate enough to have suffered an infection with the virus, we don't want you to get this vaccine until you're at least 2 weeks out from the last day that you were symptomatic. So you have to kind of not get it right away after you've had your infection, because your immune system is already revved up against the virus, and this would boost it up too much. So if you've had the infection and you've gotten through it, wait a couple of weeks and then you can get your vaccination. So those are really the main 2 reasons that we wouldn't have you get the vaccination. Once you get the vaccination in one of our centers, we'll ask you to sit for 15 minutes and be observed, because we want to make sure you don't develop a reaction. If you're going to develop one, it's usually in that first 10 minutes after the vaccine is given. Now, I was lucky enough to get the Moderna vaccine last week, exactly a week ago. I'm 66. I'm a cancer survivor. I also have type 2 diabetes, so I have some comorbidities. I really wanted it. And because I'm kind of a first responder to injured children, I was lucky enough to be in the first tier. I got my Moderna vaccine in my left arm, and I can tell you the only symptom I had was a little bit of soreness in that arm. I didn't have any fever. I didn't have any nausea. I didn't have any problems other than a little bit of soreness like I've had before when I've gotten a flu shot or some of the other injections. So I certainly sailed through it. But that's the thing that people tell us is the most common symptom, is a little soreness or even a little redness where the shot was in the arm, maybe a little bit of night fever after the injection is given, and sometimes a little bit of fatigue the next day. But in general, these are very mild symptoms. We have not had any in Worcester yet of the anaphylaxis type thing, the severe allergic reaction yet. So that's something that I think one sees, but if you screen for the people correctly, you should be able to eliminate that possibility. So the vaccine is a very different kind of vaccine than you may remember from the days of getting a polio vaccination or measles, mumps, and rubella vaccinations. You're not getting in this vaccination a piece of an actual virus injected into you that's been kind of made tame, and then your body makes antibodies to this defanged virus. You're not getting the virus. This particular vaccination, what you're getting is a chunk of the virus's mRNA. That's a chemical messenger that's in the genes of the virus that tells the body when it gets the injection to make a certain protein. It's called the spike protein. The spike protein causes your immune system to react to it. And when that happens, the body makes both antibodies and these special kind of white blood cells that are called killer T cells, and they attack wherever they see the spike protein. So that's why the virus it doesn't stand a chance against this kind of vaccine, because the spike protein is all over the surface of the coronavirus, and as soon as you get that vaccination, you're able to make antibodies immediately to that spike protein, which will stifle the virus. So that's why it's not as likely that you're going to get sick from getting the vaccination as you did all these years getting the flu. There were any people that said, I felt like I had the flu the next day. You're not going to feel that way. That's what the beauty of this this vaccination is. So I wanted to say something else, because there are a lot of people, and I know you know some of them, that are kind of hesitant about getting the vaccination. They doubt it. There's a whole different bunch of groups of people that are concerned about getting this virus. There is a group of people that just in general don't like vaccinations. They don't believe in vaccinations, and they're worried that somehow this is going to harm their body. Unfortunately, there's really nothing I can do to argue against that, except it's not scientifically proven that any of these vaccinations cause harm, but so be it. That's a group. We call them the anti-vaxxers. There's another group that are just what we, I guess, would call don't tread on me people. They're the people that say, I don't want the government to tell me what to do. I don't want to get the vaccine. I just don't want to be told. Then there's a group of people that say, this Operation Warp Speed was too fast. How did they get this vaccination so quickly? We all started getting sick in March, and by December we had this thing rolled out. It's too fast. So that's what I want to address a little bit now. the reason it seemed very fast was that all through the years from about 1994 all the way up to today, every time there was a big outbreak, whether it was the SARS outbreak in Asia in 2003 or the MERS outbreak in the Mediterranean area in 2005, or the H1N1 swine flu outbreak in 2009, or the Ebola outbreak in 2014, or the Zika virus outbreak in 2016, every time that happened, another building block to the technology that went into designing this particular vaccination was added onto the armamentarium of the scientists. And so when they were faced with this particular virus, they knew exactly how to design the vaccine because they were just primed and ready based on all the other experiences that they've had. So this wasn't cooked up in somebody's bathtub just the day after the pandemic was recognized in March. It really was something that was known, and it was just, a tribute to these brilliant scientists, these virologists and gene therapy experts, that they could put this thing together as quickly as they did, get excellent trials with 95% results of efficacy. That's just amazing. So we shouldn't be doubting that. We should be praising that. And that group of people, I think, with a little bit of explanation, maybe we can talk them into getting the vaccination. Then there's another group, the community of color, the Latinx community, that unfortunately have had some very bad interactions with the medical community over the years. There have been times when experimentation was done without the participants' knowledge. There have been times when different kind of medical discoveries were made without notifying the people that were donating cells or serum to help make these discoveries go through. So those communities are skeptical a little bit about doctors in general and the medical research community. And we are really working hard with a messaging campaign that's going to be ongoing that Dr. Castile, who's our Commissioner of Health and Human Services, is going to be taking the lead on to help that community have a little more trust in what's been done to make this vaccine happen. I think all of the hesitancy aside, what we're seeing now that the vaccine is available is much more on the other side. Like, when can I get mine? When can I get mine? And I'm very enthusiastic about that, because that means that people are buying into the notion that getting vaccinated is the best weapon we have now to fight this disease. If we can get 70 to 75% of our community vaccinated, we get what's called herd immunity. And that's when you'll start to see all those numbers that I was quoting, those daily numbers, 200 people, 300 people, start to really drop off. That's what we're looking for. That's what we are really praying for. And if we do it the right way and get this vaccination program all the way into early summer, we're going to have some pretty normal fall and winter stuff going on. We may still have to wear a mask. And I'll tell you a funny story about this mask thing. Remember, I think one of the last sessions I did with you, I asked everybody to still remember to get the flu shot. Well, flu this year has been really, really dormant. Not a bad flu season at all yet. We've got some more months to go, but one of the reasons is that people are wearing their masks. The masks can really prevent the droplets that lead to infections from flu and also from COVID. So with people being so compliant about the mask wearing for COVID, they're actually been fighting the flu too. So we're very excited about the notion that we finally have something else other than the 3 W's to fight with. And this vaccination is going to be great. It's not going to cause you harm. And once we get through this first phase of getting all the medical people vaccinated so they can continue to take care of you in the hospital. We currently have about 300 medical personnel in Worcester that are out either quarantining or in isolation because they caught the virus. Usually they don't catch it from patients. They catch it from just being back in Worcester after they leave the hospital setting. So if we want to prevent our workers from burning out, we have to keep the level of COVID down in the community. And otherwise, we're going to find that, medical staff are going to be so short-staffed, they're doing double shifts, triple shifts. They're going to really be very, very, very fried by the end of this period. So anything that you can do to help support them, they're wonderful people, whether it's nurses, doctors, medical students, residents, respiratory therapists, and all of the people that help the hospital go, the people that clean our floors, the people that work the food services, the people that do the registrations in the clinics. All these people need to be vaccinated so we can keep them healthy enough to keep us safe once we, unfortunately, turn up sick. So that's the main thrust of all of this, is if we can get through this together, the community does its part, the medical community does its part, the city does its part, we will get through this just like we have so far. So that's my message here. It is a happy new year. 2021 is going to be a very, very good year. We've got some bumpy months coming up, but I think if you can stay with our program and keep your eyes peeled on www.worcesterma.gov for how you would sign up for vaccine when you get there, or talk to your primary care physician and see whether they're doing anything themselves to do vaccinations. The vaccine is a friend. It's not an enemy. It's nothing to be worried about. So the only other thing I'm going to mention today is I promised the wonderful people up in the Worcester Senior Center, who, as I told you, have lent the Senior Center out now as a vaccine center. So that's Amy Waters and Suki Lappin are telling us that if you go to that same website, www.worcesterma.gov, there are some wonderful online programs for seniors. The seniors who want to learn about wellness, self-defense, healthy eating and nutrition. Programming is constantly changing, and it's very, very engaging. I would urge you to take a look at what programming you see there. Once the programs happen, they're kind of taped, so you can do it at your convenience. You don't have to do it right away. The other thing I want to particularly send a message to you all from the elder buddies. Some of you may have some of these buddies. These are medical students, graduate school of biologic science students, and graduate nursing students who have volunteered to kind of keep in touch with some of you, to keep you informed about what's developed in the fight against the vaccination, fight against the virus, also to keep you informed about just what's going on in Worcester, what's going on with politics. Anything you want to talk about, they will talk about. They're called Elder Buddies. And Amy, once again, was able to set this program up with our wonderful School of Medicine, where we have the 3 schools. And they have specifically asked me to reach out and tell you that as much as they feel like they've been helping you, you've been helping them to understand what the pandemic has done to the community. And I think it's been a great learning experience for them. And I thank you for allowing them to kind of participate in your lives and be there for some of your tough moments, and also to learn from the extensive wisdom that you've accrued all these years of living in Worcester. So I guess I'm going to quit there. I know I'll be back sometime in February to talk to you some more, and by then Some of you will have started your own vaccinations, and in the meantime, be safe, be well, celebrate the year, and realize that we're getting through this, and there is light at the end of the tunnel. So this is Dr. Michael Hirsch signing off, and you take care. Be safe.